Hello, sweet friends. Today is Rare Disease Day, and I was actually asked by Lisa, so thank you, Lisa, for the inspiration for this video. She had asked me what were the symptoms that came on before I got this very rare sarcoma, and it's complicated. I'm going to give you the Cliff Note version of this because I thought it was such a good question. So before I got sick, and just to clarify, desmoid tumor is an extremely rare sarcoma. It happens in about 2 to 4 out of a million people. They don't really know what the cause is. There's some speculation that it can come on during pregnancy or can arise from different scar tissue, but there's different things there around that. And my symptoms before I got sick, when I really think back to about 2 years before I got sick, I was working an extremely stressful job as a physical therapist. We had just got married, moved, finished PT school, started working as a PT. It was very stressful. My grandfather passed away. My mother-in-law was diagnosed with colon cancer, and then my husband lost his job. And that all happened within the first year that we got married. And then we ended up moving. And so there was a lot of things when I think about just life stuff that was going on, right? And I can look back and go, oh, wow. And I was just honestly a workaholic. I didn't feel like I could ever rest, that I needed to be doing something, that my worth came from those things. And that was a piece of it. I think I didn't make time for rest or self-care. I thought I was eating a healthy diet, and that was baked potato chips and Diet Coke and fat-free skim milk and 100-calorie packs and a lot of processed food and things, whole wheat bread. That's what I thought was healthy, right? And during that time, really when I think about a year before getting sick with the desmoid tumor, I started getting sick all the time. So I started getting upper respiratory infections, sinus infections, urinary tract infections, yeast infections, BV infections, bacterial vaginosis, you name it. And I was in the doctor's office regularly. There was even strep B in my bladder, like urine testing showing that. So I would get sick, and then I would go to the doctor, and then I would get an antibiotic, and then it was this vicious cycle. And then there was yeast, and then there was, okay, let's go on something for that. And it was this cycle of every 2 weeks. My immune system was super compromised. I started gaining a lot of weight, and I wasn't really changing anything that I was doing there as far as diet or other things. My skin turned really white, pale, gray, looked completely different. And then I would go and I would work full time in the clinic, and then I would come home and crash. I had zero energy. And that was a really challenging time. I was just kind of trying to get by. I remember specifically going on a trip, and at the time, I think she was like 85, 87, my Nana, we were having a trip in the summer, and I was having to take all of these naps, and I was resting more than my 80-something-year-old Nana, and I thought something is not right about this. So I ended up seeing my doctor and saying, hey, would you test my thyroid? I think that something is not right here. And you know your body better than anybody else. I want to talk about that a lot. Hey, Liz. Hey, girl. And he refused to test my thyroid and told me that I had depression. And now my husband was with me at this appointment. He was like, Laura's not depressed. There's something wrong there. And he said, no, you just need to go on this antidepressant medication, wrote me the script, sent me on my way. So I got a second opinion on that because I knew in my heart that that was not what was going on. And I'm here to encourage you that getting a second or third or fourth opinion can save your life. And in my case, it did. So I started also having what felt like 24-hour uterine cramps. It was cramping all the time. It wasn't around my cycle. It was very uncomfortable. So I went and saw my OB-GYN, and he was my angel. He listened to me. He did a full exam. Mind you that my family doctor at the time, which I have fired, so I don't go back and see that doctor anymore, but he didn't do a full exam or anything. He just said, you're depressed. My OB-GYN palpated my abdomen, and at the time he thought it was a hernia. He felt that something wasn't right there. And so they sent me to go get a CT scan, and then I got a call saying there's a mass. It's not a hernia. So then they sent me to go get a biopsy done, and I remember completely freaking out. actually. Like, that's when I lost it. That's when I realized, hey, I'm in my 20s and I'm here getting a biopsy, and stuff just got real for me in that moment. And getting a call from my doctor, and I learned when you get a call from your physician, it's not a good thing. Usually get the nurse or somebody else, right? And they said, like, Laura, it's a mass. At the time, it was the size of golf ball to racquetball size. And they told me that it was a leiomyoma, like a fatty tissue tumor. But I was having so much pain. And so they sent me to a general surgeon, and he had told me it could be a desmoid tumor, and that could be a possibility, or it could be this fatty tissue tumor. You know, both are rare, but I was having horrible pain. I've never been pregnant, but it literally felt like something was kicking me from the inside out and was in terrible pain. I was treating my patients as a physical therapist with a heating pack over my abdomen. And in the time that we had gotten the CT scan and those testing done and to the surgery, which I think was about 3 or 4 weeks, it had grown from golf ball to racquetball size to softball size. So it had grown pretty rapidly. And I went through that surgery. They cut me from belly button down. It was a very large incision, and said, we got it all, and it's not a desmoid tumor. But because of how large it was, they actually had to put synthetic mesh in to my abdomen. And then I remember asking in the hospital, what was the pathology report? Could I see the pathology report on this? And they said it came back inconclusive. So we had to send it to, I believe, Atlanta. And I remember thinking, oh, that's not good. If it was something that was benign, we'd get an answer pretty quickly. So 2 weeks after the surgery, I got a call from my surgeon saying, we didn't get it all, and it's a desmoid tumor. And he wanted to go in and do more surgery because they had positive microscopic margins. They didn't get it all out during the surgery. And granted, that was a huge surgery. I was cut all the way down my middle, basically think of a very large vertical C-section, was in a lot of pain, had synthetic mesh in. He sent me to a radiation oncologist, and the radiation oncologist wanted to start radiation. They wanted to actually surgically remove my ovaries, put them inside of my armpits, radiate the area, and then when I finished radiation, move them back down. And that did not sound like a good thing for me. Also, the interesting thing with that radiation oncologist in particular was he would not even look at me in the eyes. He would talk to Mark. He would talk to my husband. If I would ask questions, he was very condescending. He would say, do I have to explain it to you again? Do I have to draw you a picture? It was actually a really horrible experience. And we left, and we knew that we had to go to MD Anderson Cancer Center, that they have a team of experts that focus on this desmoid tumor. Because here in my small little city, they really haven't seen this before. And there wasn't a whole lot of experience with it. So we ended up getting another opinion, going to MD Anderson, and we were told that what are they going to surgically remove? These are microscopic positive margins. We were told that radiation, I was too young for radiation, and it would fry my bowel, and I could have other complications and issues, that they took a wait and see approach with that. And so I started scans every 6 months. And MD Anderson, they're the world's cancer experts, right? And I asked them, what could I do to prevent this from coming back? Because I was told at that time that recurrence rate was 50%, and that's like flipping a coin. And I didn't really like those odds. And he told me, just continue eating the standard American diet. There's nothing that you can really do there. And I knew that that wasn't true. So I got gritty. I started researching. I found Dr. Jessica Drummond with the Integrative Women's Health Institute. I became her health coaching client. I started changing my diet and my lifestyle and honoring rest and self-care and sleep. I started bringing in these beautiful essential oils to support me both physically and emotionally and to help me reduce my toxic load. I literally changed my life. And that was my job as a stressed out, burned out PT. That was all of these things. And there were complications involved with the synthetic mesh. It actually herniated. So they went in and put more mesh in. It herniated again. It was very painful. And to be honest, I had pain from the mesh 24/7. I remember waking up after they took that tumor out and going, something isn't right. Something does not feel right. I was wearing these big abdominal binders. You just had major surgery, and they sent me back to work as a physical therapist after 2 weeks after that surgery, which was way too soon. But herniated, had these issues, and long story short, herniated again, and actually ended up seeing a specialist in Dallas who did a complex abdominal wall reconstruction. So those are the pictures. When you see the pictures of me with the drains coming out, that was after that surgery. So they removed all of the synthetic mesh as much as they could. And they moved my abdominal muscles, released my obliques to close a 12 centimeter ventral hernia because that tumor was so big. And they were kind of saying, because of the size of that tumor, your abdomen might have needed to be reconstructed from the very beginning and not plug that hole with synthetic mesh. So I was in the hospital for 5 days. I had drains coming out of me for 2 weeks. I was told that I could not work as a physical therapist for a year after that. I couldn't even bend down for 3 months. I was using grabbers. I couldn't lift anything over 5 pounds. It was a really big deal. And we were told that desmoid tumors have estrogen receptors, that pregnancy could cause a recurrence of the sarcoma. And we were also told that now that my abdomen had been completely reconstructed and there were permanent stitches holding my abdominal wall in place, that it was not medically recommended to have children. And to be told that in your 20s, we had only been married for a couple years, that was a really tough thing to hear. And I went through a lot of grieving around that. And it didn't hit me until after. I was so sick at the time. And I had lost like 25 pounds from what I am now, I think because I was just malnourished from the hernia. But it wasn't until after that complex abdominal wall reconstruction. And I remember watching Up. Up was on TV. You guys know that movie. That is a really intense movie for a children's movie. Like that opening scene. And I just remember bawling. And it like hit me. And I went through years of grief around that. And as you can see, like it still kind of comes up a little bit. But there was this process where I had to release the goals and the dreams that I thought that my life was supposed to go, right? I had to release the way that I thought life should have gone. Because I was very angry, and I had a lot of just feeling like, why me and why did this happen? And I had to release that in order to be open to the person that I was becoming and new dreams and new hopes. And that movie was very powerful for me. I think there's always like an underlying spiritual message in some of those Disney movies. And it hit me at the time that I needed to hear it. So I had to do a lot of work on forgiveness and grieving that loss of thinking that this was just how my life was going to be a mom. And redefine what that meant. And actually, when my baby nephew, Ethan, was born this past June, he has brought such a huge healing into my life to have those little glimpses of being a mama and to be able to go and be a part of his life and take care of him. That has been a really, really beautiful, powerful thing that has happened through all of this. But that is the journey. And I truly believe that because I take care of myself, because I honor myself, because I eat such a clean diet. And for me, that was doing an elimination diet of gluten, dairy, sugar, soy, corn, peanuts, and eggs. I took all of that out completely. I have reintroduced eggs, but they're organic. And I noticed that I feel okay if they're organic. If I try to do eggs at like a restaurant, it just doesn't work. I get a headache and I don't feel good afterwards. I tend to eat more of a paleo diet, grain-free. I eat grains occasionally, but not very often. And radically changing my diet, radically changing my thoughts, and doing lots of personal development work, right? Looking at all those things, mindful movement, exercise, stress reduction, optimizing sleep, optimizing self-care and rest. All of these things have been so important. And it's the work that got me into being a virtual health coach. And it's the work that got me into being an essential oil educator. And I couldn't see it at the time, but I can honestly look back and see that cancer was a really big blessing for me in a lot of ways. It woke me up. It shook me up. It brought me to my knees at times, but it let me know that I'm not invincible, that this life is such a precious, amazing life. And don't take that for granted. Don't take your health for granted. Don't wait until you get sick to value the importance of health and wellness and what you're doing. So there's a little piece of my journey. There's been a lot of pieces of my journey, from having a ruptured appendix at 2 and almost dying, to the desmoid tumor work, to work with pelvic pain, to being diagnosed with chronic Lyme disease, to adult hip dysplasia and some major orthopedic surgeries. But there's a little piece of it. Maybe at some point I'll share a little bit more of those journeys with you, but they make you who you are today. And I feel like I am better able to sit with people and hold space with people and understand more because of going through those things, those tough things. So those were kind of some of the symptoms. I can look back now and see that a year before I got sick, 2 years before I got sick, there was a lot of life stressors, changes, things going on, and I wasn't honoring my body, and I was burned out and stressed out. And honestly, through these lifestyle changes and changing all of that and the gift of doTERRA, it's completely changed me for the better. And I truly feel like by honoring my body, that is not going to come back. If I start to push again and not listen to my body and do those things, then I would be concerned. But that's my story. My biggest recommendation to you is, if you don't have peace about something, please don't do it. Get a second opinion or third opinion or fourth opinion. It can change your life. It can save your life. And continue to honor your body with all of that. But that's my story. That's my cancer thriver, right? Warrior story. I think we are all walking miracles. Be kind to everybody, because everybody has their own struggles and journey, and everybody's a miracle. Everybody's gone through tough things. So I think we need to honor that, right? But that is mine. Thank you, Lisa, for asking that question. It was as you guys can see, it was a complicated one. I didn't think it was something that I could just type an answer to. So that's why I wanted to pop on here and share. But today is Rare Disease Day, so we are going to spread some awareness for that, for my desmoid tumor friends and family and community that are struggling, or anybody going through something. It doesn't have to be cancer. We all have some challenges in our life, but I also feel like those are what are going to shape you and form you to be the person that you are, because of walking through that journey. It has changed every part of me. And for that, I am grateful, because it was a huge teacher. Have a wonderful day. Bye.